Hi guys, my name is Elise and I'm just here to talk about the causes and risks of premature birth and the lasting effects that these premature babies must live with throughout their lives. The reason I chose this topic is to educate my audience about how to care for premature babies, how to prevent premature pregnancies and births, and to just provide some general information about the risks that both the mother and the baby might face or experience during pregnancy, birth, and after the birth. 1 in every 9 infants in the US is born premature, and this is one of the huge reasons why I think that everyone should really be aware of and be prepared with what to expect and how to handle all possible outcomes of a premature birth. Preterm birth is defined as the birth of an infant before 37 weeks of pregnancy and gestation, and preterm related causes of death together account for 35% of all infant deaths in 2010, which is more than any other single cause. And this information comes directly from the CDC. Having children and building a family is something that the majority of us Americans do at some point in our lives, but what will happen when preterm labor takes this joyous, wonderful occasion and brings about unexpected anxiety, medical costs, and health risks for both the mom and the baby, and also long lasting effects on the family as a whole? I really feel that preterm labor and premature births is an important topic to talk about because of how common it is. As I mentioned before, 1 in 9 babies are premature, so statistically, at least one of us in this class, if we all decide to have children, um, will have to face the reality of premature birth. And personally, I teach preschool and I work with children every day. I experience children every day. So anything that has to do with the health or the development of a child is something that I really hold close to my heart. I just want to give you all some information about premature birth and what can increase the risk of premature labor, what kind of care is needed for the mother and for the baby in all kinds of varying situations that can cause or be a result of preterm labor, and the long lasting effects on the premature child and the family. First of all, the factors that can contribute to preterm labor are smoking, being overweight, or underweight before pregnancy, lack of prenatal care, not taking your vitamins, not keeping up with doctor visits, the use of alcohol or drugs, and IVF pregnancy, which is in vitro fertilization, being pregnant with twins or multiples, which also is common with in vitro fertilization, so those two sort of go hand in hand, and getting pregnant too soon after having a baby. And all of these risk factors are directly from WebMD. And with all of these different risk factors come possible consequences for both the mother and the child. And this could be preeclampsia, low birth weight for the child, all sorts of things that could complicate the pregnancy and complicate the birth. And caring and recovery for the mother and the child. Um, Emotional support is huge. I have nannied for a family, and the baby that I nannied for was premature, and there are so many things that come along with a premature baby. Um, she had very bad acid reflux, so with feedings, you had to be very careful and very vigilant to sit her up in between feedings so that she didn't take it down all at once and then experience the acid reflux right after. And just emotionally for the parents, that's a really hard thing to deal with. And they were very protective of her. They were very particular in how they wanted her to be taken care of. It can just be a very difficult thing to deal with when your baby is born prematurely. And like I said before, smoking, drugs, drinking, this can lead to the mother blaming herself for endangering the child. She can blame herself for her body not being able to carry the child full term. It can be very emotionally draining on the mother and the family as a whole, and they really are in need of emotional support when something like this happens. Um, Physical support and care for the baby in the last few weeks of pregnancy, those are extremely critical for the baby's development. If born too early, the lungs, the heart, and other vital parts of the body might still be underdeveloped, which can cause seriously bad complications for the baby. In addition to that, their suck and swallow coordination doesn't develop properly, which can lead to problems with feeding. This can perpetuate the low birth weight by hindering the weight gain due to the inability to properly eat. And many times, these premature infants need a feeding tube to get the necessary nutrients that they need to grow and develop. Due to the low birth weight, the underdevelopment of some vital organs can lead to long term health issues. The lungs, the underdevelopment of lungs can lead to asthma and BPD, which is bronchopulmonary dysplasia. And this is a chronic lung disease that causes the lungs to grow abnormally or become inflamed. BPD usually goes away over time, but the child may very well have asthmatic symptoms throughout his or her life. Um, Being born premature can affect the child's ability to learn, focus, communicate, and to develop physically, which can interfere with their ability to interact with their peers. And premature babies are more likely to have vision problems and hearing loss throughout their life. And this fact comes from marchofdimes.org. And just going back to the beginning, 1 in 9 babies born in the US will be born premature and will have to battle against the odds in the face of these very real consequences of preterm labor. The lifestyle that the mother and father lead while the baby is in utero can have a huge effect, greater than you might think, on the baby and the ability for the mother to carry that baby full term. Drinking and drugs and smoking cause birth defects. This is a widely known fact that still, for some reason, some people choose to ignore. Mothers can face complications, especially emotional, and the babies can have a huge variety of complications that they may face after being born premature, which again are underdeveloped organs, which can lead to lifelong disabilities, disadvantages, hearing and vision loss. And this is so important to be aware of because having a child is supposed to be the happiest time of your life, but with premature labor, it can be the scariest. And you need to be prepared for all that life may throw at you. You need to stay educated and aware about the dangers and precautions surrounding premature birth because someday it could be a friend's baby, a sibling's baby, or even yours.